Hi, Ionel. Thank you so much for joining us. Could you tell us a little bit about who you are and what your role is?
Hello, so I'm Ionel Sandovici, and I work as a research associate here at the Departmental Obstetrics and Gynecology. And I'm also associated with the Institute for Metabolic Science and the Center for Trophoblast Research.
So do you want to tell me a little bit more about your research? There was a recent paper of yours that I read, which I think it would be good for the public to just know. What do you work on?
So I work together with Miguel Constancia, one of the group leaders here. And together we just recently published a paper that looks at how the growing baby, the placenta, and the mother communicate with each other during pregnancy. We identified for the first time a molecule that allows the communication between the baby and the placenta. We'll call it just IGF-2, but it's very similar with insulin, which, as you know, controls the levels of sugar in the blood. This molecule is produced at levels that are directly related with the size of the baby. It goes through the umbilical cord to the placenta, and when it reaches there, it controls the normal growth of the blood vessels.
I'm just curious as to where you see your research placed in terms of translation to the clinic. So how is this something that you envision helping women who are pregnant, for example?
About 10 to 15% of all pregnancy end up with babies that grew poorly during pregnancy. These babies will have significant risks for being unhealthy soon after birth, but also throughout their life. So we think that understanding how this communication takes place in a normal pregnancy will allow in the future to identify new ways to prevent cases where the baby grows to a smaller size. And we think that IGF-2 is just one of the many molecules that may lead to future changes in the diagnosis and therapy.
What do you think are the main challenges in pursuing the kind of research that you do?
This discovery phase that we are doing relies heavily on basic research, which we can do in animal models. So in a human, we can translate eventually findings that initiate in animal models. And the reason we are doing that is because by manipulating genetics, things that we can only do in animal models, we can get a first glimpse of something that may or may not eventually end up into clinics and human practice.
Thank you so much. It was lovely talking to you.
Thank you.